New warnings tonight from physicians that under Obamacare, despite the president's promises, you may not be able to keep your doctor or your hospital, and we're learning exactly why that is. Dr. Eric Novak testified before the House Oversight Committee on these concerns yesterday. He's also an orthopedic surgeon and partner at Ortho Arizona in Phoenix. Doctor, good to see you. So,
thank you, Megan.
In a nutshell, explain exactly how it's going to work, because, you know, the president has maintained all along you will be able to keep your doctor.
The short answer is there's no evidence that anybody is going to be able to keep their doctor to any significant degree. Nobody knows the rules. We don't know the rules as providers. Patients don't know the rules. And come January 1st, it's going to be very hard, even with the promises and the things that HHS is doing, to force insurers for us to know who really has coverage and who doesn't.
You talk about how access is going to become the problem, access to your doctor. What exactly do you mean by that?
Well, it isn't enough simply to give somebody a card. What we want to try to do with the law, or with any healthcare reform, is to actually lower costs and increase access. And the problem that we're seeing already, as everybody knows, is that, simply put, people don't even know if they're covered. Well, on the provider side, we don't know if the card people are coming in with actually is valid. And so ultimately, what that's going to do is reduce access. The second thing is, it's looking more and more like, with these restricted networks and lower payment structures, that very few physicians are actually going to be staying on the networks or even seeing these patients. So people are not going to be aware which doctors they can see. People with complicated problems who have multiple physicians may only have some of them covered, and that doesn't even get to the higher deductibles, co-pays, co-insurance, and medications.
Well, explain how that's a factor. I mean, if I've got a higher deductible or a higher co-pay, how is that going to affect care?
Well, obviously, people make choices. They make choices when they go to the doctor. They make choices in other places in their lives. And one of the big promises that the president made was that with this health care law, we would see lower costs. With this health care law, we would be able to keep our plan. And with this health care law, people would be able to keep their doctors. Well, we're seeing the majority of people looking like they're getting higher rates. And even the ones who are getting subsidies, that's just the premium. People who may be seeing a lower premium but seeing their deductible double or triple, that may not be an issue where they're going to go to the doctor more. If that copay goes up from $25 to $40 or $50, that's a lot more money. And if the medications aren't covered or there are no out-of-network services, it's going to mean less care for many of the people that we really needed to try to help.
You, in your testimony, talked about, you responded to a congressman who was suggesting, I'm not going to get between you, doctor, and your patient and how you do a surgery. So this claim that the government's going to get in between the doctor and patient is bogus, he was positing. And you had a response to that. Tell the viewers what it was.
Sure. Simply put, the issue was, this was Congressman Dingell, originally back from 2009, who said, I won't tell you how to do your surgery, don't tell us how to make policy. Because I had made the case that if you don't spend time doing policy carefully, good doctors, good providers, good nurses are not going to be able to do the job of getting people taken care of. And what we've seen over the last 3 years is it wasn't well thought out policy. And the result now is, well, maybe the law doesn't say how we can do the surgery, but it's certainly beginning to tell us who can get the surgery, when they can get the surgery. And that really is very disappointing from what we really wanted to achieve with meaningful health care reform, to keep health care decisions between patients, families, and their doctors, and away from politicians.
Because you're not going to do the surgery unless you get paid. I mean, it's just, you know, that's just a fact of medicine. You got to get paid for your services. Doctor, thank you for being here.
Thank you so much, Megan.